Everybody regards menstrual pain as normal. Most women, by the time they knew that they have endometriosis, it's usually 7 to 10 years later. There's always delay in diagnosis.
When they visit their doctors, the period pain symptom was not being looked into, and they get a different diagnosis. We need to have advanced minimally invasive skill in laparoscopy.
Cannot be open surgery.
Okay, the first line of treatment for endometriosis is medical treatment. And most medical treatment works for many patients. However, there are a small number of patients require surgical intervention.
Medical treatment is something we offer to all the women that we see, especially those who come early. That's why early diagnosis is very important.
Yeah.
But unfortunately, most of the women that come to us is like at a late stage disease. Okay, so few reasons why surgery is needed. Number one, they are in a lot of pain. They have tried medical treatment and they're still in a lot of pain. Then we have no choice, we have to do surgery. The other group, they are trying to get pregnant. For many years, they cannot get pregnant. They have tried everything. They have gone for IVF, they have done everything. They cannot get pregnant and they still want to get pregnant, then surgery is the other option. Another situation is when there are other organs involved. Bowel obstruction, kidneys are ureters obstructed, kidneys swollen, cannot breathe because of pneumothorax. So when you have other organs, I always tell women, uterus, ovary, not important, but your kidneys, your bowel, your lung is important. So once your disease have gone elsewhere, then sometimes you have no choice but to do surgery. Because it's a team approach, we need a team. So we have to gather the team. So when we set up Picasso, we gathered the doctors who are experienced in endometriosis. We need to work together. Multi-organ disease require multidisciplinary approach. So we gathered the team and bring all the people who are experienced with endometriosis surgery together under one roof.
Yes, the other thing is that there's no one treatment or one surgery fit for everybody. Endometriosis is a very individualized disease. So we should have a center where we can have all multiple options available. So that's why I think we should have a center where we can have, like for example, there are many ways to treat surgical management, not only surgical, but we can also do laser for fertility preservation. And then we can also have, like sometimes they can have adenomyosis. Now we can have
Ablation therapy
to
to preserve the uterus integrity. So these are the extra things that we have, that we incorporated in the surgery to maintain the fertility of the women.
Yeah, so fertility sparing is important, nerve sparing is important. So these are all modalities that should have when we offer patient surgical treatment.
With all the challenges that we mentioned in the diagnosis and the treatment and the team approach, that is why everywhere around the world, Center of Excellence in Endometriosis are being advocated, because that is the way to go. We hope to be able to be accredited as an Endometriosis Center of Excellence.
So not only that, we actually hope this Picasso to be a Center of Excellence, not only to treat the patient endometriosis better, but also we would like to train other doctors on how to manage or how to surgically manage a patient with endometriosis, so that the patient should be able to get the right doctor to operate and then give them the better outcome.